This portion of CardioSource video news coverage of AHA 2010 is brought to you by Novartis Pharmaceuticals Incorporated.
Hi, I'm Ralph Brindis, President of the American College of Cardiology. I'm here at the AHA annual session in Chicago, where a very exciting study, which is looking at management of acute myocardial infarction called CICERO, is being presented. I'm here with Dr. Youlan, who is from the University Medical Center of Groningen, who's here to tell us about that study.
Thank you for the invitation. The CICERO Trial was designed to investigate whether intracoronary administration of Abciximab, one of the glycoprotein 2B3A inhibitors, was superior to intravenous administration in improving myocardial reperfusion. And we investigated this in the setting of patients with an ST elevation MI undergoing primary PCI with thrombus aspiration. We performed an investigator-driven randomized trial comparing these two groups. And we included patients with an ST elevation myocardial infarction with a symptom start from symptom onset of shorter than 12 hours. And these patients were all pre-treated with aspirin, heparin, and high-dose clopidogrel, 600 milligrams, and then randomized after restoration of flow, preferably by the use of thrombus aspiration, to 0.25 milligrams per kilogram dose of Abciximab. The primary endpoint was the incidence of restored myocardial reperfusion, and we used an electrocardiographic endpoint named ST segment resolution as the primary endpoint. Secondary endpoint of myocardial reperfusion was an angiographical endpoint that was myocardial blush grade, which can be evaluated directly after PCI on the angiogram. And another secondary endpoint was enzymatic infarct size, and we also looked at clinical outcome at 30 days, and there was a safety endpoint of bleeding according to the TIMI classification.
Well, this is a really exciting concept, that is using the combination of an aspiration catheter along with the utilization of either intracoronary or intravenous lytic therapy in the terms of Abciximab. What did you find?
Yes. Well, the primary outcome was that intracoronary administration did not result in improvement of myocardial reperfusion as assessed by ST segment resolution, our primary endpoint. We were very surprised to find that intracoronary administration was associated with an improvement in distribution of myocardial blush grade, and that actually the incidence of myocardial blush grade 2-3 was significantly higher in the intracoronary group at 76% than in the intravenous group at 67% of patients. And also we observed that in the subset of patients in whom we could evaluate enzymatic infarct size, that the infarct size was approximately 30% smaller in the group treated with intracoronary administration.
Terrific. How much more challenging would it be for a clinician to actually give intracoronary versus intravenous Abciximab?
Well, all the studies until now, including our own CICERO trial, have shown that there are no increased risks related to use of intracoronary administration, seeing similar bleeding rates in both groups. And therefore, we don't think that there is any reason not to perform intracoronary administration in patients. At least there is no harm as we see it now.
Well, this is a very exciting advance. It clearly needs more study over time, and congratulations to you and your colleagues for this terrific study.
Thank you.
Special thanks to Novartis Pharmaceuticals Incorporated for supporting continuing coverage of CardioSource video news at AHA 2010.